Having one record was crucial. We really needed to bring all of that information together. Having separate records was very difficult to navigate. I think that it creates a more cohesive record for a patient, and we're able to identify trends, we're able to see what types of treatments need to happen without having to piece together multiple different records. It's important for us to be able to have a smooth flow of information wherever that patient might land in our facility.
Before we went to Expanse, our clinics had a different EHR than the hospital, which just was a very time-consuming process when we had patients coming into the hospital. It was just more work to get their clinic records. So to have something that both providers and nursing can see the whole care sequence of the patient has just allowed for, just that next step of patient care.
What we discovered is the more communication that you have and ability to get that data in to be able to see it, and the more that we can establish and have that data there present when the patient is present with me, the more likely it is I can limit the amount of time I spend chasing and trying to give them the information that they need.
I know what those providers are going through in the clinics with their patients. By having the unified electronic health record system, I can see what they've been doing and they can see what I have done and how we're going to continue to manage this patient together as a team. It's not in other systems where you might have a private practice, family practice physician or family medicine physician who sends a patient into the hospital. The ER and the hospital teams have no idea what's been done. So they repeat everything, first of all, so there's an expense, and also there's real lack of information sharing, and so bad things happen because they just don't know. And there's no way in those divided systems to properly document so that people can actually have all that information in one location.
Going to Expanse really helped that. Our providers love that they have one EMR to deal with, and our patients really like the portal. It's less confusing for them to have all the information in one place.
Data in itself is not the solution. It's not the cure, okay? But what data does is it helps you to make decisions with patients. It helps you, especially if you have it real time, to then be able to say, well, today this is what we know and this is how we can make that plan together moving forward.